54-year-old Lisa Marie Presley died last Thursday while hospitalized in critical condition after reportedly going into cardiac arrest.
Joining us on the KOGO News Live line, cardiologist Dr. Fahmi Farah. What is it that causes cardiac arrest in someone so young?
There are actually several things that can cause cardiac arrest in someone young. In her case, 54 cardiac arrest. My top of my list would be heart attack. It's very possible to have a heart attack being at that age, especially given her family history.
So, and this leads me to wonder: are cardiac arrests often fatal?
Yes, they are, especially if the cardiac arrest is an out-of-hospital cardiac arrest. The statistics are very poor when it comes to survival. Between 70 to 90% of those who have an out-of-hospital cardiac arrest don't even make it to the hospital alive. So yes, the statistics are very poor.
Now, what about women? Are there certain things that you need to watch out for? Because if you looked at Lisa Marie Presley, she was thin. She looked like she was in pretty good shape. So she didn't have most of the things that you kind of generally associate with cardiac arrest.
You're absolutely correct. There's a misconception out there that heart disease is most prevalent among men. That's actually not correct. Heart disease is by far the number one killer for both men and women here in the United States and worldwide. And women are no exception to this. Young females can get heart attack and die. I have treated multiple women in their 30s having massive heart attacks. So just the fact that she's thin, she's fit, does not mean that she's not at risk simply because of other factors like the lifestyle, the stress factor, how well she was taking care of herself, what kind of food she was eating, was she exercising? And then the major factor is genetics. If she has family history of heart disease, that's definitely something that's going against her.
Now, how much of a leg up do you have if somebody had seen, because I think she was found unconscious, if somebody had seen her collapse and they started CPR right away, would that really increase the odds of survival?
Yes, it does, significantly. So the timing of starting CPR really matters in terms of cardiac arrest and what their survival chances will be. And so that's why it's very important for people to become trained to do CPR, and really anyone can train to do that. You don't have to be a medical professional to do that.
Now, if the heart stops, how much time does it generally take before the brain function stops?
It's not very long. It's within minutes. And so the brain is very dependent on oxygen. And so whenever we have a cardiac arrest, it means our heart just stops, and so blood flow stops. And when blood stops going to the brain, the oxygen is cut off from the brain, and so the brain damage occurs. And that's one of the reasons why CPR is so important to start early on. It's not just the survival, it's also to prevent brain death from happening.
Dr. Fahmi Farah joining us here on the KOGO News Live line. Thank you so much for your time.
Thank you for having me.